Laura, the floor is yours.
Thank you, Abigail. Good morning, everyone, and welcome to the first webinar of the thematic network of mental health in all policies. My name is Laura Marchetti, and I'm policy manager at Mental Health Europe. For those of you that might not know us, Mental Health Europe is the largest independent network working in the field of mental health in Europe. I will not go into details of what we do. You can find information about our work on our website, mhe-sme.org. I see here that we have over 120 attendees, so we are very pleased that this first webinar has been attracted quite a lot of interest from different stakeholders, and this is indeed what we are trying to do with this thematic network. Given that I think there is a large consensus now that mental health of everyone is being impacted not only by health, but is very much impacted by a variety of determinants that include social inclusion, education, employment, and so on. So we are really trying with this webinar to go beyond the health sector to understand what are the issues when it comes to policies that are not strictly on health, what are the issues that can impact the mental health of people, and why it's important to take an approach that includes mental health across the policy sectors. This is, as I mentioned, this is the first webinar for the thematic network, and the idea is that what is being discussed today will feed into the statement that we will issue towards the end of April or in May. We don't have an exact date yet. So if you are part of our thematic network, you are already aware that we are going to continue the work after this webinar. If you're not and you are interested to join, you can do so through the health policy platform. But now I'll go quickly through the agenda of today's meeting. After this, I will give the floor to Stefan from the European Commission that will go a bit more into depth on the work of this network. Then David will kind of set the scene and pinpoint some of the benefits that we know that a mental health in all policy can have. And then we will go directly into the theme of today, which is digitalization, and I will give the floor to Leanda Barrington-Leach from the Five Rights Foundation, and she will discuss about the impact of digitalization on children's mental health. After her intervention, there will be a moment for a Q&A, and then we will move on to Sarah Copsey from EU OSHA, the agency that works on health and safety, and she will be discussed about the impact on digital tools on the well-being of workers, followed by a Q&A, and we will end with Marsha Brophy from UNICEF, who will talk about possible solution when it comes, possible digital solution when it comes to vulnerable population, in particular children. This will also be followed by a Q&A, and then we will finish again with an intervention from the Commission, from Jerome de Barros, that will give a kind of overall comment, and I will briefly do a closing remarks, very short, I promise, and then we're off for today. So thank you very much. As a quick reminder, given that we're going a bit over time for for the speakers of today's webinar, I might have to intervene to kind of remind you that your time slot is coming to an end. So apologies if I'll have to interrupt you. And now I'll give the floor to Stefan.
Good morning, everybody, and thanks for the invitation. My name is Stefan Kranian, and I work at DG Santé. I have a short presentation, and I look forward to hear the contributions of everybody else on the role and the impact of digitalization and in mental health. Next slide, please. So I'm going to speak very briefly on the purpose of a thematic network. Through these networks on specific health-related topics, the Commission wishes to encourage the cooperation and the sharing of information between civil society stakeholders, and at the same time encourage them to develop a number of joint initiatives or joint actions that can help to progress the issue. The purpose of the thematic network is then that it leads to a joint statement within 1 year, and that joint statement will summarize the common position of the members of that thematic network on that specific issue. Uh, we need to keep in mind that this joint statement cannot be a wish list to the Commission or to the member states, but it is rather meant as as actions that the members of the thematic network commit themselves to do and which they will take forward. So basically, it is what you together can do that will have an impact in this area, and that's basically the purpose of the thematic network and the joint statement. Next slide, please. So this specific network comes very timely. Yeah, I'm sure you all know that the President of the Commission, von der Leyen, has announced in September during the State of the European Union that there will be a comprehensive approach to mental health. And since that announcement, DG Santé, but also the other directorate generals have been working to prepare this. They've been mapping ongoing and planned actions. They've been looking at actions and funding, all related to mental health. We will also involve the stakeholders in the preparation of this Commission initiative. One first action is the call for evidence, which we plan to launch very soon. That's an opportunity for citizens and stakeholders and whoever wants to give feedback to share their thoughts on mental health and how we can reach this comprehensive approach to mental health. Like I said, we're also involving stakeholders, but also member states. Last year, I think in December, we set up a new expert group that will replace the steering group on promotion and prevention. It's via that group that we will consult the member states on their views on this initiative. And the Commission communication is then expected to be launched in the second quarter of this year. Next slide, please. So, as I said, this specific thematic network comes very timely. So the work that Mental Health Europe and the members of the thematic network will be doing can help to support in the preparation of this Commission communication. I've listed a few possible actions here. I mean, the collection and sharing of information, best practices, experiences, that would be very helpful for us. It can help to inspire the policy making on integrated mental health policy. A second action could be that we see a reinforced cooperation between the key organizations that work on mental health and that also help to address the socio-economic and the environmental factors of mental health. Another point which is quite important is that we should, in all our work, look forward to focus on reducing the inequalities. So we should help and focus specifically on vulnerable groups, on socio-economic disadvantaged groups in our society. So this would be migrants, children, the elderly, people who are currently without a job, or people with a low education. So we should see that we focus our work on addressing these specific groups. And then as a fourth point, it would be very useful if this thematic work could continue after the joint statement, so we can continue having this dialogue on mental health, and also the cooperation between the members of this thematic network can continue, and the development of joint initiatives and actions can continue. Next slide. And I think that was my contribution today. I've given a short update on the purpose of the thematic network and where we stand with the Commission on this, on the development of the Commission communication on mental health. And I look forward to hear the contributions today on the role and the impact of the digitalization on mental health. Thank you very much.
Thank you, Stefan. Without any further ado, I will just give the floor directly to David from the London School of Economics.
Thank you very much, Laura. Good morning, everyone. Before we move into the session on the digital interventions, the digital approach, I've been asked to set the scene. And that's what I'll try and do. And I really want to emphasize the importance of thinking about mental health from a mental health in all policies perspective. Because if there's one area of health which really does have impacts beyond healthcare systems, it absolutely is mental health. And living with mental health conditions has many, many impacts on the way we work, our education, our relationships with others, and many of the most effective interventions to improve and strengthen and promote our mental health don't happen in healthcare systems. They happen outside. They happen in the way we live our lives at work, good work environments, good environments in the school setting, help and support for vulnerable groups is very important. And so I just want to make a few very brief points to emphasize this, and you'll hear me repeat myself several times that this is about multiple impacts across different sectors, and crucially as well, there are benefits to these other sectors if they think much more about mental health, and work is a good example. It's really good to promote a good environment to promote and protect mental health in the workplace. This helps businesses as well. It's a win-win situation, and it's the same for schools. But improving the environment for children benefits their mental health, it benefits their educational outcomes, and that benefits schools and society as a whole. The alternative, of course, is we don't think about these broader impacts, then we're in trouble. If I had an hour to talk rather than 6 minutes or so I've got left, I could provide enormous amounts of information on the long-term and often lifetime consequences, actually, of living with unsupported mental health needs, poor educational outcomes. So that's where the schools come in. Low employment rates. There's more we can do to get people into work and to make work a mentally healthier environment. There are impacts on health as well. We shouldn't ignore those. There's impacts around crime and so forth as well. And that's really about people being vulnerable, and impacts of poverty, that impacts on people's lives and well-being. There's suicide, the self-harm impacts, but there's other things as well not on that slide, around housing, around the way in which people are included within societal decision-making, even the right to vote and so forth. So there are many, many impacts across many, many sectors, and not taking action is not a good idea because it has consequences for these sectors that go beyond the mental health consequences themselves. Let me show you a very old slide from colleagues of mine at the LSE, but still as relevant today as it was when it was published 20 odd years ago. It's showing the long-term impacts for children living with behavioural conditions in England. And what you can see from the slide, you don't need to worry about the actual numbers or anything like that, is that this shows the long-term costs to health and other sectors for kids living with mental health conditions. And for those with the most severe conditions, there's a bit of health spending, but most of it is about social care. It's about criminal justice. It's about the education system. It's about everything but the healthcare system. So investing in mental health and dealing with some of these issues is likely to have impacts and benefits much, much wider than the health system. I thought I'd give you a quick example as well of something related to digitalisation, and that's cyberbullying and indeed traditional bullying, face-to-face bullying as well. It's a real problem for young people, but also in workplaces as well, thinking about it. And there's lots of evidence building up now showing there are a range of interventions that can make a difference to help people who are the victims of bullying, or indeed maybe the people who do the bullying. And again, you don't need to worry too much about the detail of this slide, but the point here is that there are many, many impacts, long-term impacts of bullying, and most of these are not to do with healthcare systems. The top slide there, that one of the top rows, CAMH, is about child and adolescent mental health. But beyond that, we're talking about impacts on schools, the lost opportunity to earn a living over the lifetime because of more exclusion from employment, because bullying is linked to poor mental health. The lost opportunity to own a home, which was an important thing in this particular British study that we did. So again, there are multiple impacts across multiple sectors, and they last a long, long time. What about work? That's another topic that Sarah's going to talk about in a bit, and digitalisation in the workplace. There is an enormous amount of information, absolutely enormous, around the relationships between work and mental health. We also know that the largest single cost of poor mental health is actually exclusion from work, or reduced productivity at work, or less time spent at work in both paid and unpaid activities. I do stress that it's not just about paid work, but work is also a great place to be creative. You know, it can make a real difference to European economies and beyond, but it's really about promoting a workplace that has a positive, healthy, mental health related environment. That makes a big difference. It's worth companies doing that. There's a business case for doing this as well. And crucially, it's also about not just about problems that may happen in the workplace, stress in the workplace, but it's also a place where we can recognize problems from outside work and provide help, because we spend a lot of our time at work. I put here on the screen a slide from the European Foundation for the Improvement of Living and Working Conditions, and one of their recent reports. They highlight the European Company Survey from 2019. And again, you don't need to worry about the detail of the slide, but what it's basically saying is that companies that have higher levels of well-being, and here we're talking about psychological well-being, tend to be, or in countries, well, this is in countries, but it's the same for companies as well, tend to have better performance. Okay, so better workplace well-being, better company performance, they do go hand in hand. And there are some countries that do better than others at this, but a key message is that only 20% of EU organisations are really, in this particular survey, really promoting the kind of mental health positive conditions that actually will allow these situations to develop. Better voice for employees, more autonomy, you know, in terms of independence and how we do our work, promoting training and learning, all these kinds of things. But there's a business case, a strong business case for thinking about mental health within workplaces, better mental health, getting people back into work where mental health problems occur while at work, etc. So, you know, again, if I had hours to talk about this, I could provide a long presentation, but I can't. But I hope the point is clear, is that the workplace is a really important area for thinking about our mental health. Finally, because I'm trying to really catch up a little bit on the time for us all, I just wanted to think a little bit about the third area that's going to be spoken about today, which is about vulnerable groups, and I'm guessing it may be about, for instance, migrants and refugees. I should say in the 1 minute or so I've got left that I mean, this is blowing my own trumpet, I suppose, but there's an EU-funded study just coming to an end at the moment called Strengths, which has been looking at online interventions for refugees, and there'll be some interesting findings coming out of that. But a key thing about vulnerable groups, again, working across all policies, is that it's not just about the mental health interventions alone. It's about, for instance, welfare conditions. If you're talking about a vulnerable group moving to a host country, if they don't have access to the welfare system or the employment system, if they don't have access to decent housing, etc., that has negative impacts on people's mental health. We know that from many studies. And it's not just for migrants and refugees, it's for many, many other groups in society. So again, when we think of mental health and actions across all policies, looking at welfare and poverty alleviation, those kinds of measures are those kinds of actions, debt relief, debt avoidance, are very important as well. And I've just highlighted here one particular slide showing that it sounds kind of obvious, really. If you improve, if it will protect people's basic incomes, then that actually has positive impacts on their mental health as well, and wider benefits for society, I would argue. So I've tried very briefly to just try to emphasize the point that this is really an area where we have to take an all policy approach. Our mental health is influenced by actions across everything we do: work, education, housing, etc., etc. There are impacts on different groups, but it is an all of society approach. But most of the consequences are also society wide. They're not just about health systems. And this is where I think the digital world has a really important role to play, because more and more of us are living in kind of digital worlds, hence this webinar today and so forth, and different working environments, risks of online harm we'll hear about, etc., etc. So lots of things to think about, and they do need to be thought about from an all health and all policies and mental health and all policies perspective. So that's it for me. I've tried to keep to the time. And if you do want to contact me further, my details are on the slides. And now I'll hand back to Laura, I think.
Yeah, thank you, David. Thank you for your presentation and for sticking to the time. You made my job a bit easier. Now I will immediately move on to Leanda from the Five Rights Foundation. And I would like to remind everyone that after Leanda's presentation, we will have a quick time for a Q&A. So if you have any question, do please put it in the chat and we will discuss it during the Q&A. Thank you.
Thank you, Laura. Hello, everyone. Sorry, I'm trying to get onto one screen, which is proving a little bit tricky at the moment. So if that does not work, you'll have to excuse me if I am looking in another direction. So my name is Leanda Barrington-Leach, and I work at the Five Rights Foundation, which is an NGO with the mission to build the digital world that children and young people deserve. I'm very grateful for the invitation to speak here today and for the attention that the European Commission is paying to the mental health of children in the digital era. I'm also grateful to David for his presentation, which I think really sets the scene very, very well for what I'm going to say today. So first of all, just the Five Rights Foundation, as I said, we're an NGO, we work internationally, we work very closely with children. We also do our own research, we work with IT practitioners to develop technical standards, and a lot of what we do is providing expert support to regulators around the world. As examples of our work, for those who don't know us, we chaired the drafting committee for the UN Committee on the Rights of the Child, General Comment number 25, which is really the foundational document that sets out how the Convention on the Rights of the Child, so how the rights of children apply in the digital environment. We were also the architects of the Age Appropriate Design Code, which is the first legally binding code for age-appropriate design of digital products and services. And that code and its principles are now also reflected in other EU countries, notably in particular in Ireland, as well as in California now, where they're also legally binding. We also oversaw the development of a technical standard for industry for age-appropriate design, and we're currently working on getting that transformed into an EU standard. So today I have been asked to speak about what we can do to ensure children's safety in the online environment, and I will set out 5 principles to frame the conversation that I hope this group will then take forward. But first, I think it's important to take a few moments to consider the issues and what we really do need to address. So the first thing to recognise is that the digital environment is not optional for children today. Childhood today is lived online as it is offline, and pretty much all children are online. They make up 1 in 3 users of digital services globally, and they spend a lot and an increasing amount of their time in the digital environment. The second point to note is that childhood is not recognised online. So very differently from the physical world, where children are treated in almost every aspect of their lives in a manner deferential to their age and their development capacities, in the online world, there is one basic rule. That is that everyone, all users, are equal. Often anonymous, certainly equal. In other words, everyone is treated as an adult. Consequently, the digital products and services that children use are for the most part not designed with their rights or their needs or their vulnerabilities in mind. And even those that do purport to be specifically for children, in almost all cases, they still put the commercial interests of the product or service before the best interests of the child. Thus, for example, 80% of apps, or at least of the top 50, apps rated suitable for children under 5, or 5 and under in the Apple App Store, still contain in-app purchases. There is a solid and growing body of evidence attesting to the impact on children and on their mental health in particular. So let me give you a few examples. Consider, for example, addiction and sleep deprivation. Here I am going to spend some time looking this way, because I need to get the stats right. So 4 in 10 children say they rarely disconnect from social media. And various studies find that between a third and half of kids worry themselves that they are addicted to the internet. 72% of teenagers say they often or sometimes check for messages or notifications as soon as they wake up in the morning, while roughly 4 in 10 teenagers say they feel anxious when they do not have their cell phone with them. 61% say they would struggle to last longer than 24 hours without access to social media, with many suggesting that it would make them anxious, lonely, or distressed. Consider body image. 40% of teenagers say images on social media cause them to worry about their body image. 80% of girls have considered changing their appearance online, and many will not post at all without using a filter. Consider gender-based violence and child sexual exploitation and abuse. 58% of girls have been harassed or abused online, causing many of them also to silence themselves. 90% of girls and 50% of boys say they are frequently or sometimes sent explicit photos or videos. 80% of girls say it is common to be put under pressure to provide sexual images of themselves. This is becoming something which is very normalized. So please do consider the vicious circle, and the vicious circle also of violence that this is creating for our children. 10% of 12 and 13-year-olds say themselves that they are addicted to porn. 10% of 12 and 13-year-olds. Over half of boys and 40% of girls think that porn is realistic. In 80% of self-generated child sexual abuse material videos, the victims are girls aged 11 to 13, and it's getting younger. Self-generated sexual imagery of children aged 7 to 10 has increased threefold in the last year, making it the fastest growing age group. And in the majority of self-generated child sexual abuse material content, the girls were found to be copying the language of pornography. In 1/4 of child sexual abuse cases, the perpetrator is themselves under 18. 70%, I know I'm giving you a lot of stats, but I hope it's painting a picture. 70% of consumers of child sexual abuse material on the dark web say they first accessed such material when they were children themselves. 40% of them when they were under the age of 13. More than half say they stumbled across this material accidentally. Somehow it was served up to them. I could talk about similar vicious circles fueling bullying, eating disorders, self-harm and suicide. I could talk about the erosion of social relationships and conflicts within families over screen time. I could talk about polarization and even recruitment to extremist causes. And obviously, we could certainly talk about how offline vulnerabilities are exacerbated online and vice versa. So the impact really is undeniable, but the cause is also undeniable. We humans, we're far from perfect. People put a lot of nasty stuff out there, and some do really bad things. Kids themselves are also busy exploring and testing the limits. However, the way that popular digital Yes, I can share data. The way that popular digital products and services are designed pushes the risks far beyond the reasonable. It gives a platform to the worst of human nature and exploits our vulnerabilities. Those who suffer the most are children, especially the most vulnerable children. The data economy is essentially an attention economy. It intentionally uses persuasive design to get and keep users online, getting them engaging, sharing, and creating content. To do this, it exploits psychological techniques, grounded, for example, in our survival instinct bias, which leads us to pay more attention to a threat than to good news, or in our nature as social animals motivated by the desire to be liked. Five Rights' Pathways research, and I will share after the webinar links to all of the documents I mentioned. So our Pathways research, it showed that social media accounts registered as children, so the platform knew that this was a child. They were all subject to messaging from strangers and illegal or harmful content within hours of being set up. So because they knew they were children, these accounts on the one hand were targeted with advertisements specifically for children for example, games, sweets, teenage tampons, educational material. But at the same time, the recommender systems were recommending harmful content from sexualized to pro-suicide material. And this is because the algorithms, we know from whistleblowers, weight negative or extreme content 5 times higher than neutral or positive content. The boom itself.
Leander, sorry to interrupt. I just wanted to check with you whether it would be possible to come to a conclusion, or if you have just to have an idea of how much you have to present still.
Sorry, my apologies, Laura. I can get quite enthusiastic. I'll go straight. I'll go straight very quickly to my 5 principles, which is where I will finish. So 5 principles. First of all, we need to recognize childhood online. Someone who's 13 is obviously not a child, and also we need to understand that younger children have more supervision and older children often also use more services, and therefore all children deserve and require protections. Secondly, it's very important to recognize that children have existing rights and that their rights follow the child. Firstly, that means that we should not get distracted about conversations about ethics or the invention of new digital rights. No, we should be talking about children's rights. Also, it does mean that any effective action needs to cover all products or services, big or small, that children are likely to access. We must resist any attempts to complicate things and divide it into boxes, for example, online platforms, AI, etc. We absolutely need a holistic approach. Third principle, the solution must be delivered upstream by integrating children's rights by design and defaults. So this does mean that we need to take a product safety approach. It also can't be about shutting children out from spaces where they have a right to be. And importantly, it cannot be all about digital literacy or parental controls. This often sounds like a very good idea, but we cannot ask children or parents to hold responsibility for badly designed systems. Fourth principle, the approach must be tech neutral and outcome based. These systems are designed for optimization, right? They can be optimized for profit. They need to be optimized first and foremost with the best interests of the child. So this is a choice by companies, right? It's not a question of technical, it's not a technical issue. It's a question of what you choose to optimize for. Fifth, my last principle, and then I promise I'll wrap up, is that focusing on outcomes means focusing on driving positive change rather than looking back and seeking to punish. We must not develop a system where it's all about, suing. It is about, as I say, identifying risk, mitigating harm, working upstream to make things safer from the start so that everybody has, so companies also need a positive incentive to innovate. And this is everything that we propose works around these 5 principles. I'm wrapping up. Just in conclusion, I want to end on a positive note and a challenge for this community to take up. So the positive is very much that there is growing awareness of these issues and there's growing political will to address them. The devil, however, is in the detail, and in particular as regards enforcement. So here my challenge. When we speak to policymakers about the need, for example, for the updated EU product safety law to cover all digital products and consider mental health risks, the pushback we get is often about expertise and evidence. How are market surveillance authorities supposed to assess mental health risks and impacts? We need to connect the dots and to gather evidence linking specific features and services to specific outcomes. At the end of last year, there was a very important breakthrough when a court in the UK ruled that a meta content recommendation system had contributed to the death of a 13-year-old in a more than minimal way. This was very clearly unwelcome for the company, but then so what? Who can prove that this was not an isolated sad case? The OECD has started a project to gather evidence of AI harms into a database, starting with media coverage. Perhaps this can be the basis of the practical tool that regulators need. Perhaps in conjunction with, for example, an EU pilot project, linking child helplines, mental health professionals and social services, and providing systematic analysis and categorization of evidence. There is in any case plenty of work to do, and I hope that together we can ensure that children have a safer online experience. Thank you, and apologies for running over time.
No problem. Thank you, Leanda. Thank you for the very interesting presentation. I see there have been quite a few questions on the chat, and they are being also addressed in the chat. So I will, to save time, I will move on to the next speaker. But before, there is actually a question for you about the data that you already mentioned you will share. Someone was asking what type of data you were sharing, whether they were UK data or EU global, like what was the scope covered by this number?
It depends. Some of the data is American, some of it's UK, some of it's European, some of it's global.
Okay.
I'll do my best to share sources for everything.
Thank you. And I see there was a question also about funding for Stefan, and he has already addressed that. So I will quickly move on because I'm trying to recuperate the time that we have lost at the beginning. So I will quickly move on to our next speaker, which is Sarah Copsey from EU OSHA, to move on from children and education and the impact of digitalization on children to the impact of the digitalization on workers. Sarah, the floor is yours.
All right, thanks very much, and good morning, everybody, and thank you for the invitation to participate. I'm going to address digitalisation and psychosocial risk prevention in the workplace and give a couple of examples related to vulnerable groups. So just to summarise, psychosocial risks at work arise from poor work design, organisation and management, as well as poor social context at work, including factors such as work demands, having control over your work, poor communication, and poorly managed organizational change. Work-related stress results when the combined effect of or the total load of this long list of work-related factors are beyond a worker's capacity to cope with them. This capacity can be moderated to a limited extent only by individual factors such as resilience, but it is only limited, and they may result in negative psychological, physical, and social outcomes. These can be emotional, such as anxiety, cognitive, such as difficulty concentrating, or behavioral, such as making errors, or ill health, such as depression. So in 2020, well, I can't remember, it's end of 2021-22, EU OSHA commissioned a flash barometer survey to gain insights into the state of occupational safety and health in post-pandemic workplaces, and it included some questions on use of digital technologies at work. In this respect, over half of respondents reported that they control their pace of work. 44% said that digital technology results in them working alone. 37% that they increase their workload. A third that they increase surveillance, and a fifth that they reduce their work autonomy. These are all psychosocial risks, and they are all work organisational problems. In addition, regarding digitalisation and work, another stressor is poor human technology interfaces, be it controls of robotics or poorly designed software. There can be a blurring of work and life, for example, in relation to teleworking, and we all need the right to disconnect. While technology is increasing sedentary work, there could be a link between sedentary lifestyles and depression. Algorithms, new technologies, and new jobs and ways of working will lead to a gender bias and discrimination if gender is not mainstreamed into their development and implementation. And there's a real fear amongst workers for the future about role changes and possible job losses. Digitalisation may also exacerbate traditional psychosocial risks, such as poor communication. For example, extra or different forms of communication are needed for virtual team working. And as has been mentioned, the online world opens up new channels for both violence and bullying from the public and internal workplace bullying in the form of cyberbullying and trolling. So, and other features we're seeing are things like the gamification of work, where workers can earn extra points if they make more deliveries or fill more customer requests. But this can lead to them working too fast or too long. And good change management in the digital age is even more important. So all these issues need addressing in jobs, work organisation, software and device design, and they need addressing in health and safety risk assessments and management. Regarding prevention of psychosocial risks, there's a hierarchy of 3 intervention levels that apply to all occupational safety and health risks, whether we are talking about asthma and dermatitis or work-related stress. And also stress can only be successfully managed if it is tackled at the levels of both the individual and the organisation. And this implies action at 3 levels. At the primary level, action is needed to identify and address risk factors at the level of the organisation, such as work overload or poor communication. This is done using the tool of risk assessment to identify the risk factors and introduce measures. As has been mentioned, mental health promotion also needs to be part of this primary prevention approach. The secondary level involves individuals or groups who need additional support and tools to help them deal more effectively with stress. So this could be resilience training to deal with emotionally demanding work. And tertiary prevention comes into play when the individual is experiencing mental health problems to help them deal with the consequences of exposure to stress and to manage their symptoms. So this could be consultations with a psychologist. However, the second and third level will fail if there is not effective prevention in the workplace of the source of risk factors. So this means using risk assessment to first improve the work environment and then looking for individual measures. So regarding one group, aging workers, digitalisation has the potential to make work easier for the aging workforce by making work more interesting and physically less demanding, so helping to make work more sustainable over the working life. Age-specific needs, however, need to be taken into account for things like software design and training to use it. And due to the fast-changing working environment, skills may become outdated faster than the individual is able to learn new ones. So perhaps things like reverse mentoring schemes would help in the workplace where younger workers coach older ones. And obviously lifelong learning becomes even more important in the fast-moving digital age. older workers' experience should be recognised in the workplace, and they should be consulted over their needs in the design of new systems. However, digital technologies can also support workers who have developed a chronic condition, for example, to continue working. So, for example, the use of voice-activated software or assistive technologies for those with rheumatism and arthritis, or access to teleworking can help manage working with a chronic condition, or also for older workers caring for elderly relatives. And we know that staying in work, good quality work, is positive for mental health. Regarding people with mental disorders in the workplace, they cope differently with work and relational demands. But these differences can be positive for the organisation, and they can provide novel views and approaches to the organisations, but they can face specific challenges. So this means that tailored approaches are needed for employees with mental disorders when interacting with digitalisation, taking into account their strengths and capabilities and not only their vulnerabilities. So, for example, digitalisation can provide alternative means of communication or support with managing fluctuating workloads, and working from home can benefit some people. So we need what you might say adjustable technology for a diverse workforce. So in general, how can we ensure safe and healthy and productive ways of working for a diverse workforce? Firstly, occupational safety and health should be considered at the start, using a user-centered prevention through work approach. And the safer and healthier and easier you make work for all workers, the easier it is for vulnerable workers in general as well. In workplace risk assessments, which are required by law, proper consideration should be given to new forms of work and management. Risk assessment for health and safety should never be delegated to technology. And humans should remain in command of the technology and their work. And technology and artificial intelligence should support and not replace human control and decisions. The need to collect worker data should be balanced against the rights of workers to privacy and their safety and health. And there needs to be transparency. Workers' participation, which is important in all areas of occupational safety and health, and equal access of workers and employers to information. All stakeholders, including designers, managers and workers, must be given information and training about the relevant health and safety issues. And we need to raise awareness and give more attention to the impact of mental health at the research, policy and practice levels. As we've heard with child safety online, these are choices for companies and designers. Digital work can be positive or negative, but it depends how systems and work are organized and designed and used. So in conclusion, digitalization brings new psychosocial risks to the workplace and can intensify existing ones. It has the potential to improve work and reduce stress, including for vulnerable workers, if a person-centered approach is taken to create meaningful jobs where workers are in control. Both psychosocial and work organizational risks, as well as physical risks, need to be taken account in devising new work systems, software and devices. And work should be improved for all workers, taking account of the needs of a diverse workforce. Thanks very much for your attention. And you can find plenty of free resources on psychosocial risks and the management of risks from digitalisation on the EU OSHA website.
Thank you, Sarah. If that's okay, I would like to propose to quickly maybe reshuffle a bit the agenda, in the sense that I would maybe propose to move on to the next presentation, and I will be a bit strict with the timing so that we can use that Q&A to also address some of the questions that we're receiving, because I see that there are some questions also for Leandra. So if it's okay with all the speakers and the technical team at the Commission as well, I would just keep that Q&A so we can address all of the questions and we don't risk to go over time, because I'm also aware that it's coming to lunchtime. Would that be okay with everybody?
From the HPP team is fine.
Okay, thank you. Then in this case, I will directly move on to Marsha Brophy from UNICEF to discuss about the digital solution to address the needs of vulnerable groups.
Hi, good afternoon. Thank you, Laura. And good afternoon, ladies and gentlemen. It is my honour to be invited to present to you today at this important webinar. My name is Dr. Marcia Brophy. I'm a child psychologist and a global mental health specialist working in UNICEF's headquarters programme division team. Before sharing emerging learnings from UNICEF's digital mental health work, I wanted to introduce you very briefly to UNICEF's global multi-sectorial operational framework for mental health and psychosocial support. This framework is designed to support all relevant sectors and areas of work to be more MHPSS sensitive and to scale up quality MHPSS interventions for children, adolescents, young people and families in development and humanitarian settings. This framework is distinctive because it provides UNICEF staff and partners with the tools for developing programs and strategies, including digital innovative solutions. The things I would like to highlight to you on this slide is that the framework is a child and adolescent focused application of a socio-ecological model and a life course approach. It highlights the need for the multi-layered, multi-sectorial approach with interventions that support the mental health continuum from positive mental health to severely disabling conditions. And it supports the integration of gender, disability and inclusion for all vulnerable populations. I'm underlying the importance of this framework because one of the key learnings I would like to share with you from the beginning of this presentation is that these essential building blocks that should be integrated into any new interventions development, regardless of whether they are digital or non-digital or hybrid, and yet this approach is a consistent gap in our findings. I'd like to give you a brief summary of the areas of UNICEF's work that I'm going to draw emerging learnings from for the digital mental health solutions and working with vulnerable populations. Firstly, in 2021, UNICEF's Programme Group and Office of Innovation launched UNICEF's first mental health and psychosocial wellbeing innovation portfolio. The portfolio funded promising innovative digital solutions across 9 different solutions and 23 countries. Some of the examples of projects funded were mental health chatbots to address the increased need and increased demand for youth-friendly mental health services by introducing the use of artificial intelligence to design and build a chatbot function. We looked at the use of social media channels to support mental health, using a range of existing social media platforms to cascade promotive and preventative and mental health awareness raising information and where to get services for support if needed. We looked at mental health and well-being real-time monitoring by using big data sources to identify the trends in adolescents' mental and emotional health. And our newest project, launched in October 2022, is a 3-year partnership with Spotify, exploring innovative ways to use the power of music and audio content on the Spotify platform for adolescents, youth and their caregivers to support their mental health. In January 2021, the Office of Innovation of UNICEF commissioned a mapping of external MHPSS digital innovations. In February 2022, UNICEF, among a number of other partners, supported Uplinks and World Economic Forum's Youth Mental Health Challenge. It's notable that 14 digital innovations were selected. And based on these different paths of learning, we've drafted UNICEF's MHPSS and Innovation Package. This is internally a draft being reviewed, but it will be made available later. So what have we learnt so far? What can I share with you today? Does digital technology improve access, effectiveness, efficiency, and cost? Is there less exposure to discrimination, higher consumer empowerment, and data-driven feedback? Increasing the ease with which children and adolescents can work on their mental health independently through digital self-help tools, and knowing who and where you can access additional support if needed to qualified, supervised professionals on demand has huge potential. But we need to reflect that the research on the effectiveness of mental health apps is large, but most remain unsupported by robust evidence. And most self-care apps focus predominantly on adults in high or middle income countries. But what we do begin to see is that app use tends not to be sustained, which limits their long-term effectiveness and support around mental health and psychosocial well-being. Evidence is limited in this field, where the cost of errors is high. Innovative solutions by definition are less likely to be backed by a solid body of empirical evidence. However, children's and adolescents' MHPSS is a field of work where untested solutions could lead to severe harm. Populations involved tend to be affected worse by ineffective or damaging interventions and have less agency to protect themselves. We've already heard that reflected in the earlier presentation this morning. What happens if a launch of new apps or uptake of existing apps, for example, increases the awareness, the motivation and the desire for children and young people to engage with live, in-person, professionalised support? But we know that there are still large shortages globally in a well-trained and supervised mental health workforce. We need to be thoughtful about how wraparound services that are multi-layered, multi-sectorial complement each other, including the use of digital tech. Technology-based solutions in MHPSS are attracting significant attention. Clearly, this is why we're having this webinar. For example, 90% of new mental health startups are focused on tech-based interventions only. But experts stress that proven interventions already exist, including, for example, cognitive behavioural therapy and task shifting, and that the ecosystem must ensure more policy and funding is generated for these alongside exploring new interventions. The scalability of digital solutions can be overstated as cultural context has not been taken into account in the design and can decrease their effectiveness or even cause harm due to stigma around mental health. It is important to tailor all solutions, including digital ones, to the local context. This includes culturally sensitive language. Innovators can underestimate the costs of this adaptation when estimating the scalability of new technologies. There have been several examples externally to UNICEF of sensitive information uploaded to mental health apps and websites being misused. Social media advertising has been tailored to audiences based on their mental health needs without their full consent. Creating effective policy and technological safeguards against these threats is complex and costly. Access to technology is lower among groups that already face disproportionate barriers to access mental health and psychosocial support services. Digital approaches could help expand sustainable reach of mental health services to the hardest to reach geographical locations and most excluded vulnerable groups. But we know large proportions of populations in UNICEF's focus do not have access to the internet and/or have low levels of digital literacy. I'm going to reflect now on some of the challenges more around differences between females and males looking at digital technology in terms of supporting mental health services. In low-income countries...
Sorry, before you go ahead, I wanted to check with you whether you think it would be feasible to come to an end within the next couple of minutes.
Absolutely.
Yeah, thank you.
Of course. In low-income countries, girls and women are 25% less likely than boys and men to have access to the internet. The disparities between men and women in digital access stem from part the lack of physical infrastructure, i.e. women's reduced access to public digital services such as telecentres or cyber cafes. We looked at 13% of females in India and Uganda, for example, cited the cost of internet services as a reason they do not have access. Gender bias persists in artificial intelligence and machine learning algorithms, where an estimated 85% of projects deliver outcomes influenced by human bias. Men are predominantly still designing all AI. The common drivers of each of these challenges is social norms. Within this, family resistance to females using the internet or using mobile phones is an important impediment to access. It is also not the norm for children and adolescents to have access to mobile phones, laptops at school if they are indeed in education. Research by UNICEF indicates that 2/3 of the world's school-aged children, 1.3 billion children aged 3 to 17 years old, do not have internet connections at home or access. This digital divide is perpetuating inequalities already dividing countries and communities. Let me move to my next slide here. We do not have the time here, as we know, to unpack all the other different vulnerabilities for vulnerable groups, such as those with disabilities, age sensitivities, etc., in terms of exclusion. Let me just end with some of the opportunities, though, on a bright note. The future of mental health will look markedly different from the past, as public interest in mental health continues to grow and the technology underpinning many new innovations evolves rapidly, with increased awareness of both their benefits and potential for harm. We need to nurture the right balance between several skill sets. We need to increase sums of money and longer funding cycles. We need to pay greater attention and invest in learning during these innovation processes, as we know that the evidence base is short. And then finally, the digital mental health world is booming and expanding rapidly. It is urgent for us, though, to listen to children, adolescents, their caregivers, and our frontline mental health workforce, and strategically plan a way forward as we address questions around the need to balance the risks and benefits of utilising technology within the mental health space. Or we risk doing more harm than good. Co-design is essential. We already know that there is a need to cultivate trust through common ethical principles and standards that safeguard the needs for service users, clinicians, and healthcare systems. Thank you again for inviting me to present on this important topic.
Thank you, Marcia. I will now then open the floor for our Q&A. In case you have any question, please do feel free to include it in the chat. Over the past half an hour, I think we have received a few questions, so I will start right away. There were a few questions for Leanda, particularly on the role of EU policy to address the challenges that were presented during the presentation, they were represented by you. So we have a question specific on the European strategy for a better internet for children, and whether you have any reflection on how this could tackle any of the concerns that you raised. And then there is a broader question about what you recommend in terms of digital policy to have an approach that is more mindful on mental health, to have policies that go beyond the self-regulation and code of conduct that some companies might introduce in their own in their own environment. Oh, I've just realized that Leanda is not here anymore. Oops. Or at least I cannot see her, but I wanted to check with maybe with Abigail as well. Leanda's left.
No, maybe she had an issue and then she was kicked out because I cannot find her.
Okay. Then I will quickly move on to the next question that we have received, which I think, given that the timing this was received, I think it was during the presentation of Sarah, but if I'm wrong, the person can say it in the chat. Someone is asking whether you could provide a precise real-life example of tailored approach for people with mental health problems. I think this was in reference to what you presented.
Yes, yeah. So that's the thing. It needs to be a tailored approach. So it's so it depends on the particular ways of working digital systems in the workplace itself. So So that means for different conditions, you can't say there's a standard way. But for example, a person with a schizoid personality traits may feel safer by doing digital work in isolation, being able to work alone. But on the other hand, they may need help to manage emails or chats, as they can see these as disturbing or intrusive. Or there may be a way to automatically make the system turn off notifications, etc. So that those are examples, but it's a matter of working with the individual person with knowledge of their condition to find out what's best, what's going to work best for them.
Okay, thank you. I think Leander hasn't joined us yet again. So I will maybe just ask a very general question to each of the panelists that took the floor today. So as you know, with this thematic network, we are aiming to produce a joint statement with a variety of stakeholders and partners to give concrete recommendation on how mental health can be better integrated in all policies. This specific webinar was to tackle the part on digitalization. So my question to you, given your specific field of expertise, if I'm asking you, like, what are the things that need to happen at the policy level to ensure that digital tools have a positive impact on mental health of people, whether these are children or workers or any other category of people? What, like, within your field of expertise, what do you think it's important that happens, and what do you find that we need to make sure that we include in our statement so that we can really capture what the needs are and what the expertise suggests? And here I'll open the floor to any of the panelists, and I invite you to give me your take on this.
I can start first, Lara, if you want me to.
Thank you.
Sure. Yeah, it's a great question. And I think for me, there are many responses, but the first thing that comes to the forefront of my mind as importance is, as I reflected in the presentation, co-design, really talking to the stakeholders, the service users or the beneficiaries, whatever language, the customers of that digital tool, whatever that may be, and really co-designing with them. It's something that I think is lacking, particularly in digital technology, and that we shouldn't run away with that, but there needs to be that co-design right from day one, which then also informs and includes how to ensure that people are giving informed consent and understanding how their data is being collected or used, or why they're receiving certain other data or inputs after they've used an app or something online. So I think starting with that co-design, whether it's children, adolescents, older people, male, female, and cultural sensitivity included in that, those cultural differences are key. Thank you.
Thank you.
Can I chip in, Lara?
Yes, absolutely. Yes, thank you.
A couple of kind of general observations, but I think important. First of all, I agree entirely with what Marcia has just said about co-design, co-production, involving the people who are going to use digital products themselves in that design and properly involving them, really being at the center of that process. The second thing to say is that I think it's important, though, when we think about digitalization, is that we don't forget the digitally excluded, or people who don't want to use digitalization. So absolutely, digitalization has many positive benefits, but it's also, when we think about it, think about not leaving people behind as well, who don't want to use those kinds of interventions. And I think the other thing is about trust. In areas such as workplace mental health, for instance, some workers might be concerned about how information is used, and if people talk or express or think about their mental health, they worry about where that data is going, and that may act as a barrier to the use of technologies. And my final point is that, again, with lots of apps, there are so many of them out there. How do we know which ones to trust? Or is there a way at an EU level we can somehow help with that to try and to try and give more confidence in the quality of different products? And I know that's a very difficult thing to do, but sometimes we're just bombarded by different digital options to help us, and that's a challenge in itself.
Thank you, David. And if that's okay, I mean, if there is anything that Sarah would like to add,
Yeah, I'll just quickly underline the thing about same thing about consultation. So in this case, the consultation of workers. So it's important for, well, it's a legal right actually for health and safety at work, but it's important for any occupational safety and health at risk, and it becomes even more important in the design and use of digitalized systems at work, and this whole person-centered work design approach, because new digitalization form systems have really been brought in without that kind of approach, and we're going back to a machine-driven work approach, which is no different than we've seen from when industrialization happened in the first place. So if you think of Charlie Chaplin in the film Modern Times, so that was a mechanical system driving the work, and now it's a digital system driving the work. So in some ways, with the lack of thought, digitalization is making us go backwards in terms of workplace psychological, psychosocial health and physical health, because the two go hand in hand anyway. And this whole consultation, thinking of the worker, use of the systems by users. So I challenge anyone to say that they've never at work had to struggle with an inappropriate software system that's been introduced somehow. So that's just a small example, but I mean it's endemic and it happens everywhere. Okay, I'll leave it at that. Thanks.
Thank you. As I see, unfortunately, Anda seems not to be able to join us back. And given that we have only 9 minutes left for the webinar, and I don't see any other particular question being raised, I will suggest that we approach the closing part for this event. And I will then give the floor to Jérôme from the European Commission. And oh, but I see that Marie-Yves, who's a colleague from the Five Rights Foundation, has actually addressed some of the questions for Leander in the chat. So I just wanted to flag this to the people that asked those questions. Jérôme?
Oh, sorry.
Yeah, sorry.
I wasn't
sure. Yeah, perfect.
Sorry. Good morning, everyone. So my name is Jérôme de Barroso. I'm a policy officer in DG Santé in the digital health unit, and so do not have a background or work on mental health. So it has been very interesting, and I should learn quite a lot from the interventions from previous participants. So in my case, trying to make the link with digital aspects of what has been presented. So I tried to look at some of the objectives of the network when it comes to digital aspects, and I could see that the network identifies as one of its priorities to provide recommendations on the need to collect data at national level, but also at services level to report on mental health indicators, to reflect social determinants of mental health and human rights. So clearly there's a link with some of our ongoing policies and initiatives that we are developing as a commission together with the member states. And I would start with For example, the recently proposed legislations for the European health data space. So this is a file I am personally working on. My unit is responsible for, and what it aims to address the use and reuse of health data for healthcare provisions, for care, for research and innovations, for regulatory purposes, and also for policy making, which, as we have seen in previous interventions, is such an important point. So collecting this data is important, but what I see is really leveraging this data into development for research innovations, for development of those novel digital health solutions, or for the preventions, for the management, or for the treatment of mental health conditions. It is important and something we really aim to support. And also I could say that one of the objectives is to provide guidance to the EU member states on how to ensure that mental health policies are co-created with experts. But I would add that they should also leverage on this data collected, and this is rightly identified. And I would add that one of the way EHDS is potentially contributing towards this is through a common framework for the reuse of health data. So similar way to apply for health data in all countries in Europe for the reuse of data, so for purposes other than for which they were collected. And we will also develop an infrastructure for the reuse of health data. The idea is to facilitate access to this data and its reuse. So hopefully this will be something that can contribute towards the policy objectives that the network has or is pushing for, or also the development of novel solutions that will be relevant for mental health. So indeed, research addressing mental health conditions are of great importance, and I think the presentation that we've seen are the best example. So we hope that what we're proposing through the HDS, but also other Commission activities, such as we have lots of programs supporting research and innovation in health. So we will see those novel solutions supporting Europeans with mental health in the management of their or the treatment of these diseases, and ultimately better policies benefiting all of us. And finally, also picked out from other interventions on the importance of apps in many of the projects that they highlighted. And I would add that as part of the European Health Data Space proposed legislations, we have a sections that looks at wellness apps, and in this case ensuring transparencies for users when it comes to these wellness applications. We would have a voluntary label for those apps to bring this transparency. So these were really the elements I could see that could be relevant for what has been proposed here, and where I can see several of the initiatives around digital health by the European Commission could contribute towards this work and the objectives of the network.
Thank you, Jerome. I will quickly then move on to the final remarks from this event. I would like to take this opportunity to thank all the speakers and all the participants. I think it was quite of an interesting topic to address, and a relevant, relatively new, field of work for some of us, given that, as we said at the very beginning, often mental health is addressed specifically within the health sector, but I think we all know by now that this is not enough. And going back at what are the main takeaways from, I think, all the presentation and all the input that we have been receiving, I think we've seen that although mental health, particularly poor mental health, is sometimes still only addressed within the health policy sector, we see that the impacts that poor mental health has actually a big can negatively impact other sectors like education, employment, social services. So as I think it was David at the very beginning, it says that not taking action is not really an option anymore. That there is a strong business argument to invest in positive mental health and promoting a mental health approach beyond the health sector. We've also seen that often when it comes to topic related to mental health, although some issue might often be considered a responsibility of the individual, there is actually a lot that the broader environment can do, whether this is the work environment, whether we are talking about policymaker, the structure around education and schools. So this is not an issue that can only be relegated to the individual, but it really requires a broader approach from all the stakeholders and from all the partners within a given sector. And I think as a last point, I think this was something that was virtually raised by all the speakers, the importance of co-creation or co-design or co-production, whatever the terminology you prefer, and making sure that the beneficiaries of the service and the person to which the service is being addressed are fully integrated throughout the process, from the design to the implementation and monitoring. And we've seen that this is particularly relevant, for instance, in the case of children, where Leanda mentioned the fact that childhood happens online, but online tools are not made with children in mind, and this can have, as we've seen from the data, quite important consequences. I will come to an end just to give you a quick overview of what's going to happen next. As said, this is our first webinar. We are going to hold the second one in February, where we're going to look at the impact of environment on mental health and vice versa. If you are subscribed to our newsletter or to the Health Policy Platform newsletter, you will receive information about it. If you're not, I invite you to subscribe. After this webinar, you will receive an email with both the PowerPoint presentation and the recording. For your information, the recording will only be available for the next 10 days. So if you need to rewatch something, make sure you do before the deadline expires. And I think more or less next week, we will also publish a report on the main takeaways from this webinar. All of this will be done through the Health Policy Platform and our website, the MHE website as well. And if you're not a member of our thematic network and you're interested in getting involved, please do join, as we are just starting the work. So this would be a really good moment to get involved. And I think I hope I mentioned everything. If there is anything that I forgotten to mention, do let my colleagues and the other panelists do let me know. And I will close by thanking you again for participating, thanking all the speakers for their very fruitful input, and thank you also for the time. I know it wasn't super great, and I apologize if I had to interrupt some of you, but I think we managed to finish within the time, so all good in the end. Yes. The Health Policy Platform survey, yeah, we're going to put it in the chat. And now it's on the screen.